A very good evening to my dear friends. I will be talking about some ocular tumors. To start with, there are some benign tumors, conjunctival which are. So conjunctival benign tumors are in four groups: nevus, papilloma, pyogenic granuloma, and choristoma, which include dermoid and lipodermoid. So I'll make a small video for each tumor. So first, what is nevus? So nevus basically is a conjunctival nevus. When you talk about it, is relatively uncommon condition and it is usually unilateral. Histology, there are two types: junctional and compound. So in junctional nevus, the nest of nevus cell, they lie at the junction of epithelial layer and subepithelial layer. This is junctional nevus. In compound nevus, same thing, the nest of nevus cell lie at the junction of epithelial and subepithelial layer, along with they involve the subepithelial stroma, and there is downward proliferation of stratified squamous epithelium containing goblet cells. So junctional nevus and compound. So junctional, it is at the level of epithelial and subepithelial layer. Compound, it is at the level of epithelial and subepithelial layer along with involvement of subepithelial stroma and downward proliferation of stratified squamous epithelium containing goblet cell. Now, the compound nevi are more common as compared to junctional nevi. Now, how is the presentation? So, it is, as I said, it is unilateral, and the age when it present is the first 2 decades of life, complaining of either ocular irritation or a pigmented lesion. Signs: you see a solitary, sharply demarcated, a flat or slightly elevated intraepithelial bulbar lesion. The common location is juxtalimbal. The next common location is plica and the caruncle. So the pigmentation, it varies. It may be non-pigmented also. There may be cystic area also present. Pigmentation and the size may increase at the time of puberty. In children and adolescent, this nevi may appear as inflamed due to dilated feeder vessel. So the sign is a sharply demarcated lesion. It is present juxtalimbal most commonly, otherwise plica and the caruncle. It may be non-pigmented also, and there may be cystic area. And the size will increase as well as the pigmentation size and the pigmentation increase at the time of puberty. Now, what is the treatment for the nevi? So the excision is a treatment. The indications for excision of a nevus is mainly cosmetic and sometimes when you're suspecting a malignancy. Now, what signs will indicate a suspicion for malignancy? There are 4 signs. As I said, the nevus usually increases or it may increase at the time of puberty. So the sudden increase in the size and the pigmentation, number 1 indication. Second is extension on the cornea. Unusual location in the fornix or the palpebral conjunctiva. And finally, uh, development of vascularity except in a child. As I said, in children it may normally also will appear inflamed. So 4 signs which will indicate malignancy are, I repeat, sudden enlargement or increase in the pigmentation, extension on the cornea, unusual location in the plica, unusual location in the fornix of the conjunctiva, that is unusual, and finally development of vascularity. Okay, so hereby we completed the nevus. So basically the benign tumor, there can be junctional or a compound nevus. Presentation is mainly a pigmented lesion in the first 2 decades of life. On examination, you see a sharply demarcated flat lesion, intraepithelial bulbar. The common location is juxtalimbal. The next common is plica and the caruncle. Then it may be pigmented, it may not be pigmented, it may be cystic. Okay. So, and usually it increases around the time of puberty. And what is the indication for treatment? It is mainly cosmetic. You do an excision. And as I already told you, there are 4 signs for malignancy: sudden increase, extension in the cornea, unusual location, that is the fornix or the palpebral conjunctiva, and development of vascularity. Okay, goodbye.